everybody have their sheet?
Yes.
Everybody knows what goes on the mail stand, right?
Yes.
We want all four Kelly's curve. Make sure that you clamp them all before you put them on here. Should all be clamped once after. 2 straights. Two peons. Peons should be loaded with a kidney. Peanut, whatever you want to call it. Should be about at the halfway point. Okay? Another way to load these is if you grab both of the end pieces and squeeze it together. So if you're not really sure, make one of each and the surgeon will tell you which one you like better. But you have to have a nice little tip, because that's how we dissect soft tissues, okay? Alright, 2 cokers. Two Alice clamps and 2 back pops. And you have your right angles. On those right angles, Karen Thompson. So that's where your 3 ties come in. Just to keep your 3 ties a little bit more organized and you don't lose any of them, use a hand towel. Flip it open once, doesn't matter which way. Open it up. Grasp the end of it. Pull it out. Lay it in there with one end hanging out. Close it. Pull it. There you go.
Okay.
Alright, that way you just have them hanging out. Leave them on your mail stand like this. That way when you need to reload these, you just pull one out.
Oh,
And ready to go.
That is
So you'll have one back loaded where it's coming out of the back. Leave about ½ an inch. Then you'll have one front loaded where it's coming out the front.
back and front.
Usually depends on what the surgeon likes best, how they're using it. Clamp it down. What they'll do, they'll put it, take it underneath the vessel or something, grab it with the bakies, and then they can tie something off. Right? Make sure you always look for your end, that way it doesn't fall off the table, get contaminated. Right. What's next?
Beds and bombs.
That's gongs, right? All of your scissors. All of your scissors. Maybe that's bombs. Your straight nails and your curved nails. Right. Always leave these out laying like this, that way you can differentiate them easier. Right. So you have refuse, athens, and the babies. Okay. Any questions about the meal plan? Go ahead and set up. Why do you guys touch my stuff?
He was touching. He pushed me onto it.
Actually, let's make an example out of that. What would happen if this corner, or how could we fix if this corner was contaminated?
Bleach.
You use this, for example, little drapes, which are nice anyway because they have the little stickies on them. Take the sticky off.
I didn't touch it at all.
Just leave it there. Cover it.
Cool.
There you go. Alright. Double basin stand. Usually it should cover all the edges of the basin stand. If not, If not, prevent getting anything contaminated, get an extra half sheet, lay it on top of it, and create your own sterile area. Make sure that you don't go beneath anything, so just kind of shuffle it out. And then circulate, you can fix the rest of it. You only need this if it's not covered properly. Okay? Take one basin. Okay, basin. Okay. As soon as the circulating has time, you can ask her to please give you some sterile saline, and then you make sure that you label your sterile saline. Right? Since most of the basins are already labeled, make sure you verbalize that. Make sure you verbalize that you're labeling any of the fluids. Most of the packs have these little nifty trash bags. You can hang these right here. Throw all your trash in there just to keep it clean, if you want to. Right. So your bulk syringe is going to go with the fluid. Here you have your labels, skid marker. That way you can write down that you have the normal saline in there. And then the last thing you have to do is make your sponge sticks. So you grab a Raytech, flip it in half. Make sure that the stripe is on the outside. Flip in one corner, as such. Take your forceps, place them on there open, and tuck in all 3 corners. Make it nice and tight. Pump it in there. Like that.
Again.
You're pretty good at typing, aren't you?
Okay.
Wow. It's cute.
Usually you don't need this bucket. If you want to hand that off, that's fine with me. Usually keep that for just in case. Alright, what do you check for before you open that?
SYCA.
You guys got your practice?
What it actually is.
Okay. See?
No, we did.
Alright, no one saying, good to go.
Go.
You can go ahead and add it.
Pour it,
I'll show you guys how to actually load the acceptance
so you're gonna pour it on the bowl?
in the bowl.
Yes, all the ball.
It's gonna get a
Oh no.
little bit back. Get that string on. There you go. Photo. Don't let the last drop go in there. Pull away, pull away. There you go. So when you load the asepto, push in with your thumb all the way, stick it in there, let go. Upside down, push it in again. Stick it in there. That way it's completely full. Okay. So don't do one of these numbers, put in the number and keep that out. It's not gonna work. It's not gonna happen. Any questions? Do you guys want to go over gowning, gloving, and surgeon again?
No. Never again.
You good to
Is
go?
that everything?
That is it.
Mother.
Can we play with it?
Let's play with it.
Oh, here we go. I thought we used to be telling you. Excuse me.
Oh, okay.
Hurry,
Let's take pictures of a first car.
hurry up so I can play with the stuff.